and members of the subcommittee. Thank you for the opportunity to testify before you today and share my story about what access to innovation means to me. It means more time with my wife, my kids, my grandson. My name is Tony Gonzales. I am 48 years old from Santa Maria, California, and last year I was diagnosed with mild cognitive impairment. I know this disease can destroy careers, relationships, and every day it robs me more and more of my memories. A few years ago, my family and I noticed the first few signs that something was wrong. Then one day I got lost coming home from work. I was in my hometown. I was in my car on a road that I had driven thousands of times, and I had no idea where I was. I had no idea where I'd been or where I was going. All I knew was I needed to call my wife for help. I spent the next couple of years searching for an answer. 2 years after my initial symptoms, I finally received a diagnosis: mild cognitive impairment. When I was diagnosed, it would have given me so much hope to have the opportunity to access treatments that can give me more time. I'd like to have the chance to make the decision if the treatments are right for me and my family, instead of Medicare making that decision for me. I became a member of the Alzheimer's Association Early Stage Advisory Group to help raise awareness of this disease, especially for those people who are under 65 and not typically the face of the Alzheimer's disease. When I'm in a meeting and someone tells me they've never met someone with dementia, I say to them, well, now you have. You see, I want people to see the impact of this disease that it has on real people and real families in America. The incredible bipartisan support for increases in Alzheimer's research, funding at the NIH over the years, are starting to pay off. In the last year and a half, we've seen 2 treatments get FDA approval and another one that will submit to the FDA soon. These treatments have the ability to change the course of this disease. The fact that they exist and are approved by the FDA, and yet people like me cannot access them because of Medicare, is frustrating and humiliating. As many of you know, CMS is restricting access to these breakthrough therapies by creating additional hoops to jump through. This creates even more of a barrier to care for people living in rural and underserved communities like those in my hometown. Medicare is treating people with MCI and Alzheimer's differently when they apply this restriction to an entire class of drugs, current and future. This action has a ripple effect as well. Private insurance and health systems follow Medicare's lead. If Medicare won't cover, chances are that other insurances won't either, and health systems won't make it available, thus taking more time away from people, including for me and others who aren't on Medicare. This is an urgent issue. The Alzheimer's Association estimates more than 2,000 individuals aged 65 or older transition per day outside eligibility for these treatments. As of today, that number is approximately 248,000 people who have progressed past the point of eligibility since approval in January. Keep in mind, this number doesn't even include people like me who are under 65. Earlier this year, nearly 100 bipartisan members of Congress, including many on this subcommittee, sent letters to the administration raising concerns with CMS's coverage policies around these FDA-approved Alzheimer's treatment. Thank you. As recently as last week, another company announced positive top-line results for their new Alzheimer's treatment. This innovation will mean nothing without access. CMS must immediately reconsider. They must look at the clear evidence now before them, and when they do, I trust they will acknowledge that these treatments are absolutely reasonable and necessary for people like me with a terrible progressive disease and no other treatment options. Refusing to take another look at NCD further expands the divide between CMS and the Alzheimer's community. We're losing time, and this is unacceptable. More time is more than just a number of months or years that I may gain from such treatments. I wake up every day hoping to know who I am, who my wife is, who my kids are. When I wake up and I realize that, it's a win. So I live for today. I want more time to be with my grandson, Sandy, take him to the park, and to be able to do that on my own. I don't drive anymore, but I can still hang out with him and spend time with him. You see, when you get a death diagnosis, it becomes very clear to you. Having more time means everything to me. It would allow me to walk my daughter down the aisle, meet another grandchild. It gives me another chance at living my best every single day. Time to live again, time to hope again. It truly is an honor to speak with you today and share my story. I hope it inspires all of you to continue your work, urging CMS to treat those with Alzheimer's fairly. And lastly, I hope you remember to live for today. Love those around you. I wish you all good brain health, and I look forward to answering any questions you may have. Thank you.
Thank you. It was very inspiring. Mr. Okan, you are recognized.
Chairman Buchanan, Ranking Member Doggett, and members of the Health Subcommittee. I am the Executive Director of the Community Oncology Alliance, a nonprofit organization dedicated to cancer patients and their independent oncology providers. My wife, Susan,